From a growing child to a young adult, everyday aging takes place. And that means that as you walk, as you do different activities, your muscles, your bones, they get tired and need to rest. And now there's a particular condition that a lot of females, and mostly around the ages of 40, tend to have osteoarthritis. I'm sure you've seen someone that tells you that I have knee pain, and the first thing you might have thought of, you have osteoarthritis. You're not far from it anyways. But the thing is that osteoarthritis is broader than just normal knee. It happens in your knee, it happens in the shoulder, it happens in the fingers, it happens in the ankles also. But definitely the most common is osteoarthritis, is the knee osteoarthritis. Now, what does it mean exactly? Basically means an inflammation of the joints. Who are those that can have it? When I was in school, one of the things we learned was that osteoarthritis happens to people that are from the ages of 40 and above, mostly females. Very true. But recently in practice, I realized that a lot of people come down with osteoarthritis before 40. Some at the age of in their 20s. Yes, it's possible, and this can be because of their genetics and things like that. That's very possible. So aside from this particular condition and wear and tear, genetics can also predispose you to these particular things. Before I go ahead, let me talk about the risk factors. The genetics. If someone in your family has osteoarthritis, you may or may not have osteoarthritis. One of the reasons that might make the person have osteoarthritis earlier is because of the fact that the person walks a lot. The person does movements that makes he or she strain the ankle or the knee, that particular part, and that can cause issues. Also, as someone that is obese, obesity can actually cause this particular factor. We also have trauma. Trauma can lead to osteoarthritis and the person will feel pain. Let's say a knee part can lead to osteoarthritis. Now, another thing before I move ahead is that if you have osteoarthritis, what are the symptoms that go with this particular condition? I'll list them for you so you understand. The first one I'll talk to us is pain. You see the person always written in pain in the knee, touching the pain, you're going up the stairs, coming down, there's pain, you're just alone and there's pain. You might really have osteoarthritis. Number two symptoms I'll be talking about is swelling around a particular joint. Now, for some people, not every single person has swelling around the joint. It might occur in some more severe than the others. Number two, when the person wakes up in the morning with stiffness, morning stiffness, meaning that because you've not moved your joint for a long period of time, that is now feel stiff. It's an indicator that the person might be having osteoarthritis in the. Another one is also warmth around a particular place. The person will feel warm, and we can also see tenderness in that particular area. Once you can click off these 5 symptoms, tenderness, inflammation, warmth, morning stiffness, and pain, these 5 ones, you most likely are dealing with osteoarthritis, and it can be relieved, can actually managed properly. Now, how can it be managed properly?